Congestive heart failure, or CHF, in dogs may be the consequences of disease such as myxomatous mitral valve disease, MMVD, dilated cardiomyopathy, DCM, endocardiosis, or cor pulmonale. These conditions can predispose to systolic or diastolic failure, volume or pressure overload, congestion, or dysrhythmias within the heart, and would manifest as clinical signs such as pale mucous membranes, exercise intolerance, dyspnea, and edema. The sympathetic response to compensate for a fall in cardiac output results in an increase in contractility, heart rate, and vasoconstriction, which would increase afterload and thus work on the heart. Pimobendan, a benzimidazole pyridoxine derivative, is used to treat CHF secondary to DCM, or chronic mitral valve insufficiency, in dogs. The drug's positive inotropic and vasodilatory properties, or collectively inodilator properties, result in increased myocardial contractility and systemic vessel width, leading to a decreased preload and afterload on the heart. Pimobendan exerts its effects through inhibition of phosphodiesterase 3, an enzyme responsible for the breakdown of cyclic AMP to AMP. The resultant increased concentration of intracellular cyclic AMP in cardiac tissue causes an exaggerated activation of calcium channels on the sarcoplasmic reticulum. This sensitizes cardiomyocytes to the influx of calcium ions. The influx increases cross-bridge formation and heart muscle contractility, thus improving cardiac output. The secondary effect of the increased intracellular cyclic AMP in vascular smooth muscle caused by pimobendan's pharmacodynamic activity is vasodilation. Cyclic AMP inactivates myosin light chain kinase, preventing the phosphorylation of myosin heads and thereby reducing cross-bridge formation in smooth muscle. Systemic vasodilation ensues, resulting in a decreased preload and afterload in the heart. By easing systemic hypertension and pulmonary capillary pressure, symptoms such as hypertension, dyspnea, and edema are relieved. Systematic reviews and pivotal clinical trials compare this relatively new drug pimobendan to placebo and strongly support the drug's efficacy and clinical use in delaying the onset and treating symptoms of CHF in dogs. It was found to significantly reduce case fatality and morbidity in dogs with CHF secondary to DCM, particularly in Doberman Pinscher patients. Many randomized clinical trials exist that explore the clinical efficacy of pimobendan, both administered alone and concomitantly with a furosemide treatment regime. Some provide greater weight of evidence due to study design, larger sample size, and the easy and indisputable endpoint measure of survival time. Furthermore, head-to-head studies comparing pimobendan to the gold standard CHF treatment, consisting of an ACE inhibitor and diuretic, demonstrate improved quality of life and overall survival time with single-agent pimobendan. Many of these studies conducted, despite having small sample sizes, are blinded and have control populations, adding weight to their evidence, which demonstrate that pimobendan is statistically efficacious in prolonging survival time. A limitation of these studies, and an area of future study, was the increase in incidence of sudden death in the pimobendan-administered dogs, in comparison to the treatment or placebo group. Future study may be able to determine whether this was truly the impact of pimobendan, or rather the result of prolonged survival time. Further studies determining the effectiveness of pimobendan at different stages of CHF, and possibly in different species, is pivotal. There is a lack of research in regards to the patient's quality of life, and further studies in this area may be essential. Double-blinded studies with larger sample sizes are necessary to reveal unbiased and reproducible results. However, we can be confident in the clinical use of pimobendan due to these large, multi-center studies that have consistently found a prolonged survival time in dogs suffering CHF. Thank you.